Good morning. It's still morning. It's great to be here. What a great day to start out the mobile vaccination clinic. Beside me today are Commissioner Jean Lambert of the Department of Health and Human Services, FEMA Regional Administrator Paul Ford, excuse me, Town Manager Adam Garland, Oxford Casino General Manager Jack Sowers, there he is. And they are some of the many people to whom we owe a great debt of gratitude and appreciation today for helping set up this important milestone in the greatest logistical challenge Maine and the nation has undertaken in generations. Our teams at DHHS and CDC, healthcare providers, and volunteers around the state have been working around the clock to get shots in arms to protect all Maine people from the COVID-19 virus. As a result, Maine ranks among the top states in the country for getting shots into arms. But we must win the race between vaccines and the more deadly and transmissible COVID-19 variants. So when President Biden committed to deploying federal resources to help states like ours with getting shots into arms, we took him up on his offer immediately. And behind me stands the product of that partnership, a groundbreaking mobile vaccination unit, only the second of its kind in New England, one that will reach many rural and underserved communities across the state of Maine. Starting today, this mobile vaccination unit will vaccinate at least 250 people a day with the one-shot J&J vaccine. It will be here in Oxford until April 16th, most of the week, before traveling to Windham, Biddeford, Freiburg, Turner, Waterville, Old Town, Millbridge, Calais, Madawaska, and then Auburn over the next 2 months. I am so grateful to President Biden for his commitment to partnering with states like ours to get people vaccinated. I am so grateful to FEMA for their outstanding work to deliver on that promise. And with our own MEMA, Pete Rogers is somewhere here, he's busy working for helping with this as well. Appointments at the mobile vaccination sites will be available in the days before, just before the scheduled clinics, and they can be booked by calling Maine's Community Vaccination Line, 1-888-445-4111. To all Maine people ages 16 and up, and I saw a few young people, thank God, they're here. To all of you who are now eligible to receive a COVID-19 vaccine, please don't wait to schedule an appointment. Don't wait. All these vaccines, whether it's Pfizer, Moderna, or Johnson & Johnson, are safe, effective, and they are saving lives. All of these vaccines have been through rigorous trials and have been independently reviewed and tested and approved by the FDA. Please keep the faith, everyone, and stay safe. We will get through this together. I would now like to welcome FEMA Regional Administrator Paul Ford to the podium to say a few words.
Thank you, Governor.
Welcome.
Thank you and good morning, and thank you, Governor, for being here today and supporting the effort as we go forward with, as the Governor said, the second mobile vaccination unit in New England. First one was in Connecticut, and the one in Connecticut was the first in the nation. So this is a great opportunity for us to support the state of Maine and the citizens of this great state. This is a partnership between FEMA and the state of Maine that supports the jurisdictions in providing COVID-19 vaccinations for those who want one. The 11 counties that have been targeted, as the Governor indicated, is based on the CDC's Social Vulnerability Index to meet the need to be able to provide vaccinations to underserved communities. We're grateful for the support of our federal partners, some of which the Governor had met inside, the United States Department of Agriculture, the United States Department of Public Health, and 5 DHS component agencies through our surge capacity force. FEMA has clinical contractors in addition to our own FEMA staff who are here to support this for the next 60 days as it travels throughout the state of Maine. The mobile vaccination units are equipped to be able to support a minimum of 250 shots per day. That was the initial target when they first put them out, but today we are in the state of Connecticut providing 400 plus vaccinations on a daily basis, which is almost double what we initially thought we were going to be able to do.
We're going to beat that. We're going to beat that.
The governor says we're going to beat that, so I have every confidence that we will.
I.
However, this could not be done without our partnership with the state of Maine, which existed long, long before this. And as the governor indicated, Pete Rogers and I are on the phone on a regular basis to make sure that we're meeting the needs for the great state of the people of the great state of Maine. And as of April 1st, Maine has received $188 million in support from FEMA. As a result of that, they are provided to provide 3 additional vaccination sites and support for the Title 32 National Guard troops. We're excited to have this opportunity that this resource brings to Maine and brings to the additional federal staff to support the state of Maine. And we hope and we have every confidence that this will be one of the things that will be remembered as a positive as we turn the corner to beat this horrible pandemic. Thank you very much, and thank you, Governor.
Thank you, Paul. Welcome to Maine. Now I'd like to introduce Adam Garland, Town Manager of Oxford. Say a few words.
Thank you. Well, first of all, I appreciate very much the governor allowing me to speak here with you folks today. Also, thank you to FEMA and MEMA for being here and bringing all of this to Oxford. Definitely want to give a thank you to the Police Chief, Michael Ward, and Fire Chief Paul Huey, as they're the ones that are organizing our police and fire EMS coverage here as well. The town of Oxford is excited to be the site of the first state of Maine FEMA mobile clinic and to support them in their clinical operations. As many of the local folks know, I'm a new town manager here in Oxford. As a new town manager, I am working to become better acquainted with all things Oxford. The residents that I have been able to meet thus far have been very welcoming and kind, so thank you very much for that. I will say my observations would say that the town of Oxford is a hard-working community with folks that care very much about their community and the future of their community. But much like the rest of the country and the state of Maine, this pandemic has caused many hardships for the people living in Oxford. This mobile vaccine clinic is a step towards recovery and moving forward beyond these challenges. Though vaccination is not the only step that we must take towards our recovery that this pandemic has caused us, it is definitely a major step in the right direction. This clinic is a great representation of how federal, state, and local government can work together to help serve the people of Maine, as this clinic provides an opportunity not only for Oxford residents, but also our neighbors to come over. I cannot help but point out that we're in the parking lot of the Oxford Casino, which is one of Oxford's major businesses here in town. So I just want to extend a thank you for everybody coming here. I hope you take the time to visit the casino. I hope you take the time to drive down Route 26 and visit the rest of our businesses, because Oxford is open for business, and thank you for this opportunity.
Thank you, Adam. As the town manager mentioned, this is truly a private-public partnership as well. And I want to introduce to you the general manager of Oxford Casino, Jack Sowers. Say a few words.
Thank you, Governor. I wanted to start by thanking Governor Mills and her team for their leadership during these trying times. It's been a trying year, and I think you guys are doing a great job, so thank you for that. When I got the call from the administration to ask us to host this site, it was an immediate yes. This is just a wonderful opportunity for us to give back to the community where we work and we live, and it was just a win-win for us, so we said yes right away. I do want to thank FEMA. I want to thank the Maine Emergency Management Agency. I want to thank the Oxford Emergency Management Agency and the local responders. Our fire chief and our police chief are here today, and this really was a partnership of all those entities. And logistically, it came together. This is a perfect site, and I'm personally very grateful for the opportunity to give back to the community that we live and serve in. So thank you.
Thank you, Jack. Well, as Jack said, this has been a real partnership. And this is one of a number of sites where this mobile unit will be set up. I had the privilege of touring the site a few minutes ago. And while we take a lot of these things for granted, as if you could just walk up and get a shot somewhere and be protected against COVID-19, this is a tremendous effort on the part of the federal government, the state government, and local partners. And you folks have been here all weekend. like setting this up. And I was privileged to meet many people from the U.S. CDC and U.S. Public Health Services, people from Texas, Arkansas, North Carolina, maybe even Massachusetts, I'm not sure. But all giving of their time and effort to help Maine people become vaccinated and protected against this deadly virus. So Commissioner Lambrou has been here all weekend too, helping set this up. She just whispered in my ear, we ought to call this one slots and shots. But you don't get free chips to go into the casino when you get a shot though. But we'd be happy to take a few questions if you have any.
Any questions, guys? Was this funded by the previous COVID bill or the one that was just passed?
I think a mixture of the CARES money from the December and the new American Rescue Plan. Not one sole source, but several sources of federal funding, federally staffed, state assisted, and federally funded. It's a big boon to us, and as he said, it's the second one in New England, which is a privilege. We're very fortunate to have this here.
And then are there any differences between this one and the one in Connecticut?
The exact same.
Is that at a casino too?
It's
I don't know.
For Commissioner Lambrou, actually, or perhaps Governor Mills, over the weekend, new concerns about the Johnson & Johnson vaccine as far as adverse reactions as well as distribution. Are we still confident that we'll be able to get enough of the Johnson & Johnson vaccine to carry this out through the 10 counties? And how is the site prepared to respond to those who might have an adverse reaction?
I haven't heard of adverse reactions to the J&J. I'm sorry, I just haven't heard of that.
Georgia became the third state over the weekend to shut down a Johnson & Johnson vaccination site because of adverse reactions.
We haven't seen any of that in the state of Maine. If you want to add to that.
We are closely monitoring to see if there are any safety concerns. We don't see their need to shut down clinics, but because of the need for observations, the way this clinic will work is that when you leave this area, you'll either get a green or a pink card. Pink is if you might have had a history of allergic reactions, you might need 30 minutes of observation versus 15 minutes. They'll be on your windshield, and we have a team of people who are standing there and observing. They'll walk around, they ask people to honk or flash your lights if you don't feel well, and they will dismiss you. They will come and tell you your time is up. They'll take the car back and leave. We take very seriously the need to monitor circumstances, but as of this moment, we're confident the Johnson & Johnson vaccine is effective. It has effects like many of the other vaccines, but they're worth it for the protection that it gives. Thank you.
The minimum of the vaccine right now, and earlier that the max that they're giving out to their Connecticut mobile unit is 400. You say you believe that. What's the state supply of the Johnson & Johnson vaccine, and are you confident that Maine would
Right. I mean,
take that one.
the department parses these out, looking at the supply and the demand and appointments every day, pretty much. Go ahead.
Yeah, and look, our partnership with FEMA was a trade. We appreciate all the logistical support, all the personnel support, but the vaccine doses are coming from the state of Maine's allocation. We are worried that we may not have enough for this mobile clinic and other sites. The governor and myself are working with the federal government to make sure in the next 2 weeks we have sufficient doses to keep all these people busy. But we will assess, as we do every single week. We will move vaccine doses as needed because this is an essential resource. People in Oxford, Next, and Wyndham will be relying on this mobile clinic. So our job is to work with our federal partners to ensure that there's enough vaccine doses to go around.
Is our freezer inside the Pfizer and Moderna for those types of vaccine? Is there a possibility if there's not enough Johnson & Johnson that Moderna and Pfizer might be provided at the mobile vaccine?
Well, there's a possibility.
Yes.
It's certainly logistically easier to use J&J because you're going to come back in 3 or 4 weeks to get a second dose of Pfizer or Moderna, obviously.
But I will speak to but our FEMA colleagues have made sure that this clinic right here can use any of the vaccine doses. It has the appropriate freezing storage, the appropriate medical management to be able to do all 3 doses. But for ease of people coming to a mobile unit, we'd rather do this once than have the mobile unit come back here in 3 or 4 weeks to give a second dose.
Do you have a breakdown of
I don't have a breakdown. We didn't restrict it just to Oxford County residents. There are the neighboring county residents who are also eligible. We will continue to monitor that to see exactly how many of the people who visit here are from Oxford County. But that's our primary goal. And as we move through these towns, we'll be working with local organizations to really be able to do the outreach to make sure that people know it's coming, know how to get an appointment. As a reminder, next week we're going to be going to Wyndham. So beginning tomorrow, people in the Wyndham area can call that 1-800 number to get an appointment. As Governor Mills said, that number is
1-888-445-4111.
exactly.
And they should wait till a couple of days before the clinic opens to call, make an appointment, so they don't get overwhelmed. It's a balancing supply and demand.
I was just going to ask, just following up on what you're saying about J&J supplies, is it possible that you could get for the mobile unit a special allocation from the feds that would not be part of the state allocation?
That's, go ahead.
The allocation is determined by national CDC, and the part of the agreement with this unit is that there are no additional vaccines available to add to the stockpile that the state of Maine already gets. So the answer to your question is no. Unfortunately, the way in which it's designed is on a weekly basis. Each state is determined how much vaccine they will get.
Just a quick follow-up to that. Do you think, we're getting a lot fewer supplies of J&J this week, and I heard maybe next week. Do you think maybe 3 weeks from now we're going to get the supplies will be replenished? Do you have any sense of that?
I don't have any sense of that, but that would certainly be the hope that we would be able to do that.
And that's what, we all have weekly calls with the federal government. I have weekly calls with the White House, and that is what we're told. They're being, quite blunt about what they can commit to and what they can't. And as of last week, we knew that the J&J was going to be down a little bit. It's fluctuating and be up again at the end, towards the end of the month. Yes.
Fire and EMS departments questioned why you couldn't reallocate doses. They had to cancel, in one case, 500 appointments because they didn't have any Johnson & Johnson vaccines. What do you say to those fire and EMS departments that had to cancel those?
I'm sorry, where was that, sir?
That was in North Berwick.
Oh, that's right, I read about that. Well, it is a continuing balancing act between the number of appointments coming in and when they're coming in, how quickly, how gradually, and the amount of supply. And we have had to adjust pretty much every day or every other day what goes out, where it goes out, and what the supply and demand is.
So why not ship some of those vaccine doses just to cover those existing appointments
Well,
so they didn't have to cancel?
let me clarify, we don't have a warehouse full of vaccine. When we reallocate it, it's reallocated from someplace else. So it's not like we're storing it up. It's all going out the door as quickly as we get it. It's all going, not even to us, it's being allocated as it comes into the state. And if it's used up everywhere, you can't really reallocate. But it's not a perfect, it is the biggest logistical enterprise the state has ever undertaken. In fact, the nation has ever undertaken in generations.
And I'll just add, we try to urge all of our clinics to wait until they have confirmation from Maine CDC before scheduling people. We did try to find out if there were doses that could be moved from one site to another last week to support those clinics. We spent all evening the night before the final, decisions had to be made to see if we could find some doses. We couldn't, but we will continue to do that. And we urge our EMS colleagues to continue to have hope. We're going to get there. They're going to be needed. People in Maine are still lining up to get vaccinations. So as this supply opens up, we will be working with our EMS and other colleagues across the states, independent primary care providers, our federally qualified health centers. All those access points stand ready to put shots into arms, and as soon as we get those doses, we'll get them there.
Could you further elaborate on how the towns that were selected or the counties were selected to be part of this project?
Sure, I think gentleman from FEMA, the regional director here, talked about that earlier. There are a set of criteria, something like 15 criteria, defining particular areas being underserved to date, having populations that don't have easy access to other vaccination sites and the like. The rural nature of certain areas, sometimes the income level, those kinds of things. It's a whole list of criteria developed by the federal government that allow us together to target certain areas. Is
It's
that
called
right?
the Social Vulnerability Index.
Social Vulnerability Index. Are there slots available this week? I believe there are, or will be later this week. I think tomorrow is fully booked, right? The next day, probably not.
I think what they said inside was that their goal was to do 150 today, 200 tomorrow, and then 250 plus the day after that. It's a spin up. It's, this started literally half an hour ago.
Will there be more sites like this in New England?
Currently there is another site in Connecticut. Connecticut has asked for a second one and is preparing to receive a second one. There are 30 of these across the country, and it really is on a first come, first served basis, and we try to serve those underserved communities identified by the Social Vulnerability Index. So the answer is yes, but whether the state of Maine would be able to get another one, I'm not sure of that. But the state of Maine can also ask after the first 60 days if this unit is really effective and they want to continue to use it, they can request to have it extended for another 60 days.
What about Massachusetts?
Currently, we have not received a request from any of those states. The only two states that we received requests for are from Maine and Connecticut.
I understand that you want to reach these rural and underserved communities, but comparing a list of existing clinics to where the FEMA mobile unit is going, the furthest distance to an existing site is only about 8 miles. So why not go to places like Somerset County that wasn't even included on this list?
Yeah, we are working on Somerset County. I mean, there are approximately almost 200 sites across the state. And yes, Somerset County is one of our targets as well for existing, for vaccination sites. And it's not that far from Franklin County, where there's been a big uptake of vaccinations at Franklin Memorial Hospital, for instance, right next door to Somerset County. We're not necessarily looking at this as county by county. This is for all of Maine. And each area is somewhat different, but the COVID-19 virus does not respect county lines. The vaccination sites are not unique to each county. We welcome everybody at every vaccination site. So there are people from Somerset County who are getting vaccinated in other counties too.
And why bring it to places like Cumberland County that has some of the highest vaccination rates?
Wyndham, it's going to Wyndham. It's not going into Portland and the metropolitan areas. It's going to Wyndham because Wyndham fits that vulnerability, that social vulnerability index list of criteria.
All right,
So,
thank you, everyone.
thank you. Whew.
Oh, Joey.
Yeah. Thank you.
You're welcome. Here, I can do that for you.
Okay.
I didn't get the number over the door.
Hey, Pete. Thank you.
We tried to hold the rain off. Not too bad.
You did a good job.
You need one more person for you to do that.
Yeah.